Hello, I'm Dr. JJ. On your first visit with me for your naturopathic appointment, we're going to have you fill out some forms ahead of time. The forms are a little bit long, but there's a reason why they're long. I want to know as much as possible about your health goals, your disease conditions, etc. If you have any blood work, X-ray reports, MRI reports, any health reports, bring them in. The more information I have on you, the more information it gives me to find a plan that's tailored for you and to really address your health needs. So on the first visit, I'll want to know why you're here. We're going to discuss what your current health goals are and what your current diseases are. And I'll do some explaining in terms of what the meaning is of these diseases and what to expect with regards to outcome. Are these things fixable? Can these things be put into remission, etc. I also want to know if you're taking any medications. It's very important for me to make sure that if I give you something natural, it doesn't conflict with the medications you're taking. So I have a lot of background in that with my PhD in clinical pharmacology to help you avoid these drug interactions. I also want to know if you're taking any vitamins or supplements. I have patients who will take pictures of all their vitamins and supplements, or some will bring in grocery bags, and we'll do some triage, see what's appropriate, what isn't. I also want to know what your allergies are. I also want to know about your family history, so what things we could expect based on what you would have inherited from your mom and your dad and so on. And other questions. I want to know about if you've had any surgeries, any accidents, how's your sleep, how's your energy. And we'll then go through something called a review of systems. That's where we cover your body from head to toe. Any issues with your hair, with your skin, your eyes, your ears, your mouth, your lungs, your heart, breathing, urination, joint pain. We basically cover you from head to toe that way. That's called the review of systems. And then one more thing we'll do on the asking question part is I want to find out what's going on with your lifestyle. Do you smoke? Are you a coffee drinker? How much water do you drink? Are you stressed? So all those things we're going to talk about on your first visit. So when that part's done, we'll then do a physical. Physicals are very important. I'll do a physical from head to toe, your blood pressure, your eyes. It's very important for me to listen to your abdomen and to palpate your abdomen to see if you're bloated, if there's some pain. I've also unfortunately found masses in patients in their abdomen. So it's very important to do a physical exam, and all this helps me get a picture of you as a patient. At the end of your first visit, we need to come up with a plan. That's really what you're here for. You want some solutions to your health condition, to your disease. So what I'm going to give you is an outline. What supplements to take if we're going the supplement route. What medications to take if we are giving you desiccated thyroid hormone, or if I'm giving you bioidentical hormones, if that's appropriate. I also like working with other health practitioners. So if there's issues with pain or any type of visceral issues, I may send you to a chiropractor or an osteopath. If there's any stress or mental health issues or depression, I'll talk about you going to see a psychotherapist. I find they're very beneficial. We'll also talk about some lifestyle improvements, from anything to exercise, to changing your diet, stress reduction, yoga. I'll give you some channels to check out on YouTube, and some general tips to kind of bring down the stress and help to work in those areas. I'll also give you some diet suggestions. I'm happy working with your family doctor. So if there's some blood work that we need to order from your family doctor, I'll order it. And if there's additional blood work that we need to get done, I'll give you some suggestions. You could go back and talk to your family doctor and see if you could come up with a plan at their end, and both of us could work together. So regardless, when you're done your first treatment, you're given a plan. It's going to be personalized to you to help you address your health conditions and get you to the health state where you really want to be. I often get asked, what are the benefits of coming to see me, Dr. JJ, for naturopathic treatment? One of the big things I find is I spend a lot of time explaining what's going on with your health and what's going on with your disease condition. So patients have a good idea of what to expect. If their condition is fixable, if their condition can be put into remission, or if this is something that's going to be a long-term issue that they're going to have to deal with. So I find patients really appreciate that because it allows them to manage their expectations and to set their goals. A lot of things are fixable. A lot of things can be put into remissions, but some things aren't, and we just know we need to manage them, and that requires a little bit more long-term care. So I think patients appreciate the explaining and taking the time to answer questions and to explain details of their treatment plan. Another benefit people tend to find is, you should normally start to feel better. If you're not, then we're going in the wrong direction, and we make some corrections. So patients may find they get better energy, they have less pain. It all varies from patient to patient, but as a general rule, you should generally feel better. Now, in terms of timeline, my goal is to make you as healthy as you want to be and need to be. And eventually, I like to get it to a point where I'm out of the picture and you're just on cruise control and you're living your life and you're happy and everything's going great. And chronic conditions will be a little bit more complicated, but if you're dealing with things that are fixable, things that can be put into remission, we might have to do a bit more concentrated stuff in the beginning, and then later on we could back off some things, and then you go on cruise control. Then I see you every 3 months, 6 months, every year, etc. It all depends from patient to patient. But regardless, when I give you your treatment plan, I'll let you know what your outcomes are. I see a lot of different health complaints, anything from skin to hair to adjunctive cancer support, immune, stress, anxiety, digestive issues, thyroid issues. There's a lot of conditions I treat in my practice. If you fall outside of these conditions, that's okay. I see a lot of varied patients with different types of diseases. Regardless, if you come here, I will find a program that's personalized to you. I'll accept you as you are, and I'll take you from where you are now to where you want to go with respect to your health goals and respect to your health needs. Again, Dr. JJ, I'll help you find a program that's personalized for you.